Bonjour, né? That's good morning in Haitian Creole. My name is Zachary Bosca, and I will be talking to you today about communication in Haitian culture. For Haitians, communication isn't just a word, it's culture, it's history, it's faith and family, and it's all rolled in together. If we understand this as nurses, we'll be able to give respectful and our patients will trust us. So, moving on to our first point, verbal communication. Haitian Creole is the main language, and hearing it from patients instantly builds communication between the nurse and patient relationship. Haitians often use proverbs or storytelling to share their beliefs or just to talk to one another. A common saying that's translated to English is little by little the bird's nest the little by little the bird built its nest, which means that it takes time to heal. Often in Haitian culture, respect matters, especially with elders. Nurses can greet patients formally and politely, and when needed, use interpreters. This is something key because it builds trust. One thing not to do in the Haitian culture and healthcare is not to rush the conversation. Haitians value the time spent in conversation. It often shows that you care. And this is commonly used within all many different cultures, not just Haitian culture. Here is our image. You can see the warm welcome within the Haitian culture and just your smiles. And you can really tell that these Haitians value communication. So moving on to our fourth point, nonverbal communication. Haitians are very expressive. You can see there in their facial expressions, their hands. This all carries meaning. You might see a smile or a nod. This shows respect. And little to some eye contact is respectful. However, staring too much feels uncomfortable and it can be a sign as disrespect. And also, Haitians value closeness within the family. You might see Haitians hugging, sitting near each other, holding hands. Commonly, they may greet each other with a kiss on the cheek. However, in healthcare, body language is very important. It shows the nurses that communication is received. Nurses should watch out for body language. This could sometimes mean something very important, and sometimes it's what's unsaid is very important to what's actually said. If that makes sense. Moving on to our picture here, you can see these people are using facial expression, hand gestures, and you can see that the conversation is delightful. Communication in healthcare. Haitian patients may not share their pain right away. They often will share their pain if it interferes in their daily life. So that's something to keep in mind with it as nurses ourselves. They may seek home remedies, often like teas, oils, or baths. I think that's very common that Haitians use. Oil is called Grim Muscati. This oil is used when you're sick, especially when you have a cold or a flu. You put it on your back, and it's said to relieve and help flu-like symptoms. Or there's also, or something that another thing that Haitians use is tea. Many Haitians drink tea, especially who are diabetic. It's said that the certain teas that they make lower blood sugars. So moving on to our picture here. Here's a common tea used. You see the ginger, you see the cinnamon, and the cloves. They all shape Haitian culture. Communication in Haitian culture. In healthcare. So how does communication adapt to healthcare? So what works? What works is what we know now is Haitian interpreters. And when we see this in common healthcare systems, it instantly builds trust in the nurse and patient relationship. People are able to understand what disease processes and understand the directions given by medical staff. And we can also see that Haitians value prayer and spirituality. You often see Haitians praying at bedside. And what we can do as nurses in communication is see what we can do as nurses to provide that sense of relief for their spiritual and their mental need. For example, a Haitian church in Florida, a healthcare fair is held. The pastor opens with prayer. Nurse gives a screening, and information is shared in Haitian Creole. So this example is said to help nurses to realize that Haitian people have a spiritual need, and as nurses, we need to be able to advocate for that spiritual need. And doing so, we can do so through communication. Here's our next picture. Here's a group of Haitian nurses. I thought this image, this photo would shape that we need medical staff that are Haitians that to be able to adequately care for our patients' needs who are Haitian. What are some of the barriers? Well, of course, the language is the biggest barrier. Most Haitians who are raised and born in Haiti and come to America, one of the first few years they know limited English. So this creates miscommunication. So it's our job as medical providers to see that and acknowledge that and provide adequate interpreters to help these individuals. Many Haitians rely on cultural practices like prayer, even some practice in the religion of voodoo. So we just need to respect some of these different practices they may have. Here's our next image here. Next image here are some of the different barriers. The social, financial, language, lack of knowledge, the ability to access healthcare. The importance of context in Haitian culture. In Haitian culture, context is everything. Respecting greetings like bonjour, said with a smile, and patients may avoid confrontation to keep harmony. So that's something to keep in mind. So Haitians may disagree with something, but they may not be able to tell us right in front of our faces because they want to avoid conversation. So noticing those nonverbal cues are very important. Something we can do as nurses to make sure our patients understand is use the teach-back method to see how much information they've received. And we can, as nurses, if we can, learn some few words in Haitian Creole that can show the patients that we care and we want to be able to understand you. So our next image is here are some phrases that are translated to English that we can meditate on and maybe we can understand. Some words are like bonjour, good morning, napwe, see you soon, como ye, how are you doing, kilaju, how old are you. So just knowing some of these phrases will be able to help us really advocate for our patients. And we understand that communication is huge in Haitian culture. So it's our job to advocate and recognize that there's a spiritual need, there's a cultural need, and we can do so through communication.